Let's talk about suicidal ideation in the therapy room. It's not if it will happen, it's when. After 20 years of experience in the field, you get used to these topics that maybe when you're a new therapist can be a little frightening. What has allowed me to be secure, confident when suicidal ideation occurs is training. DBT has wonderful protocols to implement when your client is having these types of thoughts. They call it a safety plan, and it might not be straight from DBT, but anyway, it's very influenced the way that I do it by DBT. I create a safety plan. The first thing that I'm working on with my clients is their suicidal ideation, and it's not about getting rid of it. It's about learning how to manage it in a very safe way. People do commit suicide. It's a very real thing. My grandfather committed suicide. I have a cousin that committed suicide. I still get sad about that one. He was really young. So these things do occur. It's not like they're just thinking about it and talking about it. There's a lot of myths around it. We know this as therapists. So it's about us having a very practical plan and working with our clients in sort of a motivational interviewing style to get them to address these issues and learn how to manage the ideation when it happens. So with that being said, this is not a training on that, nor am I offering a training on that. But I think the best way for us to offer quality care to our clients is to be informed and educated. And I learned how to do this through consultation. Consultation with a therapist who had more experience and who was better trained in dealing with this. She has taught me so much. She was a certified DBT therapist, wonderful woman. She was very good at teaching me what to do. And again, consulting with other therapists when I was stuck or concerned to make sure that I was practicing in scope and that I was doing what was best for my client. Because hospitalization isn't always what's best. Sometimes it is. Sometimes it's a necessary, right? But if our client's willing to do some things and create a safety plan and do the safety plan, hospitalization might not be appropriate. So make sure you consult. Consult. Do not come up with these things on your own. We are alone in the therapy room, but we're not alone when we leave that office. We can talk with people who have more experience and who we trust, who can help us through this process.